I've literally seen color return to somebody's face just through a conversation of me listening, reflecting, answering questions, and they get up out of the chair and they've already experienced a shift, and they might look at me and say, what did you do?
Hello, welcome to Impact the World, where my guest today is Dr. Kevin Preston. So if you're interested in health in any way, or you yourself have been wondering about how you could improve your health, I think you're going to find this episode incredibly inspiring. Kevin is somebody who, after a path with traditional medicine, found himself veering towards Chinese medicine, and his passion and curiosity for health shines through in our conversation. And I found it fascinating to learn more about his journey from being someone who works one-on-one as a practitioner to following the call to expand his work to include group facilitation and retreats. And on that note, one of the things that we talk about today is Kevin's upcoming Interstellar retreat, which is taking place in October. And if you wish to attend that retreat, we have a special discount code that Kevin has given to us for all of you who watch. It is Lee15, and that will get you 15% off. So Lee15 will get you 15% off your ticket to Interstellar. And as usual, we put all of the links and details in the show notes. So check the show notes below, or you can visit Kevin's website at drkevinpreston.com. But for now, here's the conversation I had with Kevin. I hope you enjoy it as much as I enjoyed it. Kevin, thank you so much for being here today. It's lovely to meet you in person because I've seen some of your work online over the last couple of years, and so wanted to reach out and invite you to be here. Thank you for coming.
Yeah, thanks for the invitation, and that was an easy yes for sure. Thank you.
Yeah, and you've been doing your work now for 16 years in practice, but I'm curious, how did the seed of your work spark in you, and do you remember like a time in your childhood where the way that you look at the world and your spiritual nature and your interest in health and healing, was that there from early on, or did it spark a bit later?
I think if I look back from my lens now, it was there pretty early, but maybe I wasn't aware of it. But I was around health and healing in all kinds of capacities and injuring myself, and fairly rambunctious, I think, and being outside in the woods and sports and, you know, getting stitches and things like that was not uncommon. And I have two younger brothers, and so you can imagine.
Yeah.
And so, yeah, it always seemed like I was at a physiotherapy clinic or hospital here and there, and, you know, gratefully nothing major for me, but seeing injuries and really just learning about the body through firsthand experience, and animals too. Actually, we were around animals all the time, and I worked on all the neighbors' farms and things like that, and helping vet practice at times when I got a chance, and delivering baby calves, calves, and getting my hands and fingers into all kinds of things, and just really enjoying that experience, and always being a very curious person and about the world around me, and asking a lot of questions. And it's probably hard on a lot of teachers, always that kid, yeah, but why? And I just love understanding things and, gaining knowledge, and I'm not sure where that comes from, but I think that was the beginnings of enough curiosity about the human body, and having some great teachers along the way, going into science and thinking maybe I'd go into conventional medicine, and having some really great learning experiences about anatomy and physiology, and just being enamored with our bodies are incredible and complex, and I want to understand this more. And then, eventually through my own injuries, through lots of sports and hockey and surgeries, I had acupuncture. And that was that moment, I think, that you're speaking about. Is it changed things for sure, because it worked. It was something I knew nothing about, but I saw the results, and I feel like I'm a pretty practical person, and that shifted trajectory for sure.
It's funny, I was sent to acupuncture at the age of 19 by the head of my university, and I went in not knowing anything and just fell in love with it immediately. Now, I didn't go on to study Chinese medicine, but I knew I was a convert. So how did the journey from acupuncture lead you to studying Chinese medicine?
Well, I think I didn't really know what I was getting myself into. I'd had results with acupuncture, decided to shift gears, changed schools, moved, made a big transition there. And then I thought, I'll just go in, learn what I need to learn about acupuncture. Boom, I'll be out practicing in the world and doing what I'm doing. And little did I know what I was getting myself into, and it was far more deep than what I had even imagined. And I started learning about herbal medicine, which admittedly I resisted quite a bit because I felt like it was a distraction from, I'm just here for acupuncture. Like, I don't need all this other learning. And I don't know, it sort of snuck up on me a little bit. And I eventually just fell in love with herbal medicine, but it took a little bit of time. And then I realized how deep Chinese medicine actually was. And I just kept going, and then ended up doing the doctor program and just couldn't stop, having that knowledge. Once that door was open, it was just like deeply satisfying and intriguing, and things I had no understanding of when I started. And it just, the doors kept opening around understanding the body.
It's interesting because I asked you earlier about your 2 kids, and you said to me that, you were told that you and your wife and their mother was not going to be able to conceive, but you, through a combination of Chinese medicine and intentionality, it happened for you guys. So I love it when evidence of that just shows up in our own lives as well. I always think that's really powerful.
Well, and I went on to not only, we had a couple kids, and what that wasn't necessarily, what was told to us, but I also got to see it in the clinic over and over again. So I started seeing, once I got practicing, tons of fertility cases, and, people that had a lot of miscarriages maybe, or just couldn't conceive at all. And then they'd come in and we'd do a bunch of Chinese medicine, and all these kids started popping up in the waiting room, after a year or two, and pregnancies and all kinds of things. And that actually led me to get into pediatrics a little bit more, and treating kids, and certainly treating my own kids, and learning a lot more about how the younger versions of humans, the things that they have going on and the things that may need support along the way. And so it just naturally just kept pulling me along, and those little places that you don't necessarily plan for, but it becomes a thing. So I got to see a lot of really cool outcomes.
And you said to me earlier when we were talking about, you're often the person that problem clients can come to after they've taken a long journey with multiple doctors and they can't get to the bottom of what it is, and you're often their last stop, which is interesting because I have a couple of friends in my life who've had that exact same journey, years of struggling and trying to find different practitioners, and then they finally land with usually someone who is a combination of Western medicine knowledge, and alternative therapies, and that's usually when the light bulb goes off. So I know you did private clients for the last 16 years, and I know that's kind of changing for you now as we speak, because you're going more towards group work and facilitation. But what is that journey for people? I mean, I'm sure people watching may relate to it from their own experience, but what is that like for you to work with someone who's hit roadblock after roadblock? Can you just share a little bit about what the experience might be for a person?
Yeah, I think in a lot of cases they've come in and they're nearly hopeless at times, which I can appreciate if they've been on a journey of 5 or 10 years or 20 years without really getting down to the root issue, or not having the success they were looking for, or still feeling whatever their illness or whatever pattern was happening, the symptom picture. So usually one of the first things that I do with them is we talk about that, and talking about their journey. And as we start to unfold some of the things, I may ask them different questions, or they maybe get a chance to share in a way that they haven't before, because I do genuinely want to know, like, tell me about your journey, because in that process they may share some things that are little flags for me of, oh, this could have been an issue. And so I kind of see myself as a bit of an investigator of patterns, experiences, the different things people have been through often have culminated into creating the pattern that is taking place when they see me. And I would say most of the time what I've seen is that maybe the past practitioners were only seeing a part of the story and then only focused on that. And they weren't wrong, or they, in their own investigation of tests and different things like that, maybe they'd find some key pieces. But in some cases, they maybe weren't seeing how it connected to the rest of the body, or how it had connections into many other places, and, deep-rooted patterns that needed to be, sort of looked at in a new light. And so I'd often just be expanding my own view that if they're sitting there and nothing's been solved fully yet, then we need a wider scope. And so I'll just kind of keep expanding myself and my own learning and my own education and taking courses and looking at things in a different way, that I eventually could expand my scope further. And that would usually eventually include the root issue for them, or experiences that they had, or they had an infection when they were 5 years old and now they're 40. And that actually played a role in what's happening with their body now, but vastly overlooked. Or things that were too far in the past, sometimes the other doctors would say, and nothing against any of the doctors at all, but they say, oh no, that's too long ago. It couldn't possibly be influencing what's going on now. And I'd often find the opposite, that precisely that thing was what created a roadmap in their system to symptoms and issues. And if you overlook that, then you're also overlooking what could be deeper.
And I'm curious, just to kind of zoom out for a second, you know, your family and your friend group, because what you're doing, and especially what you were doing perhaps 16 years ago, is a little outside the norm, how did they react to, I mean, are any of them involved in this kind of work or healing or looking at the world through this lens, or is it not their world? And I'm curious how they responded to the way that you see things and the way that you're working in the world to help people heal.
Well, I think if I back up a little bit to my early 20s, when I decided, hey, I'm gonna shift gears, I'm not gonna continue with my science direction and conventional medicine, I think I'm gonna go into Chinese medicine. So I think there was a few raised eyebrows, some questions, and rightly so. What are you doing? And why do you want to do that? Do you know anything about it? And really just looking at it from a bigger lens. And I didn't, I didn't have a lot of life experience at that point, but I did feel that deeper feeling of something pulling me to have enough curiosity that I need to explore this. And I might be back. I'm going to move provinces. I'm going to move to a completely different place. And I don't know what's going to happen. I might be back, I might not be, but I'm going to follow this up and see what happens. And so in doing that, and then eventually gaining some skill sets, then I could do treatment for them. And they would have different issues or things coming up. So when I'd come home, I'd bring my acupuncture needles and starting to do some treatment. So they got to see some results themselves of, oh, this is interesting, even though it's kind of outside the norm of how we grew up or what we were exposed to, maybe there is something to it. And I think for me as well, getting to see results in the clinic, then I knew there was something to it, even if not everybody else understood, but I could see it over and over again that people kept getting better when you apply Chinese medicine in the right way. So I think there was probably a bit of watching from a distance, and nobody else really in my family is into health and wellness, although my mom was a nurse for many years. And so I think, that presence, even in a conventional sense, like we're around health in some way.
Yeah.
And our neighbors that we grew up with, their mom was a nurse as well. And 3 miles down the road, their mom was a nurse as well. And so there was a community of that. And one of my neighbors was a veterinarian as well. And so I got to work on animals in his presence, and some aspect of like healing, whether it was people or animals, seemed to be there. And so I think fast forward all these years later, there's been enough time for me to establish good results, learn some wisdom along the way, get some experience that I can answer different questions in a way. So I think they've become more open as time's gone by, and we can approach things in a new and different way, and quite supportive, I think, at times, even though they maybe don't understand what I'm doing fully, that there's lots of love there too. So I'm grateful for that.
We'll be right back to the conversation in just a moment, so stay tuned.
Embody your unique gifts as a healer.
I think for all of us, this is a next level time on earth, and therefore that means it's time for the healers of the world to go to the next level in their own ways of being and their ways of serving.
Next Level Healer with Lee Harris. Whether you are a seasoned practitioner or just beginning, join us for channeled guidance, powerful teaching, community engagement, and supportive worksheets, and allow your gifts to bring change, healing, and elevation to the lives of others. Deepen your creative, intuitive, and visioning abilities, overcome fears of judgment, and expand your outlook from scarcity to abundance to enhance your healing work and guide others with greater clarity and confidence. From the comfort of your home, connect with us for 2 weekends, starting May 17th and 18th. Next Level Healer with Lee Harris. Take your healing to the next level.
It's interesting because you talking about, all the people in the neighborhood who were nurses, including your mom, and then there was a veterinarian. I do think that generation, there was far less exposure to what we're all exposed to now. So in a way, that would be the equivalent of perhaps what you're doing now, because there weren't that many people doing alternative things back then versus now, where it feels like we are in a time where alternative practices and ways of healing are beginning to come in and in certain areas and with certain groups and certain people beginning to blend a little bit, which I always love the combination of the two, because I think what medical science has done is incredible. And at the same time, it's not the whole picture. And if you can blend the two, I always think that's such a potent place to sit.
I think, what you said earlier, like the Western medicine and Eastern medicine, that's kind of been my experience, and I only know my own experience with that. I think it has given me quite an advantage because of where I came from, my background, more science-based. I loved math, I loved physics, I loved the anatomy of the body and looking through that lens. And then when I started learning Chinese medicine, it was a complete paradigm shift. But when I got into it more deeply, it's incredibly scientific. It's incredibly reasonable, even though when we talk about qi and vital force energy, some people get a little bit lost with that, but maybe less now. And so I think with patients of mine, I've been able to maybe communicate differently with them in their challenges or their problems or their concerns, and I could speak to it, but then I could also bring in Eastern philosophy and Chinese medicine, but explain it in a way that they could understand and kind of change the languaging around it a little bit and give different examples. And one of my favorite examples is taught by my teachers in school. Chinese medicine views the body as a garden, and conventional medicine would view it more as a machine, and sometimes taking out parts and different things. And I'm not saying that's not valuable too. I've had surgery, grateful for that, grateful for the skill and the practitioners and the modern science behind all of that. But the deeper philosophy and the foundation of Chinese medicine is so rich and thousands of years old that they understood, I think, a greater level of wisdom of how the body works holistically, and being able to put those concepts together and kind of move them back and forth with people coming in with, various diagnoses from a conventional medicine point of view. And then I could share a Chinese medicine perspective on why that was there or how it's come to be. And then we could start unwinding it. And you could see the light bulb often go off for people just looking at it in a way that they had never thought or had never been taught to kind of think in those terms. And it's no, let's nourish the garden. Especially in fertility, it's such a beautiful example. If the soil's not well, then you could plant a seed, but it's not going to, it's not going to carry through. So what needs to happen with that person's body, mental, emotional sort of life in that garden that then can be brought online, and suddenly then you've got, beautiful things kind of growing from that soil.
With the people who would come to you for a session, were they coming to you because they were open to your modalities, or were they coming to you because they were desperate and they'd heard great things about you and so they were trying something? I'm curious what the percentage ratio was of people who were coming to you not necessarily because they were open to all the modalities, but because they were desperate and they'd heard great things about you and so they were giving it a shot. I'm just curious what that percentage is.
Well, I think that percentage has changed a lot over the years. So early career, probably more last resort. Tried other things, hadn't worked. So it's well, let's try that and, see if it works without a lot of expectation. And then in a lot of cases they would get results, and then the referrals would start coming in of people telling me, hey, so-and-so, you really helped them. That's why I'm here. Could you help me? And then it just started growing more and more. So I would say in the last, 5 to 10 years, it's been all referral. We never had really advertised very much at all. And just more people kept showing up, and I just kept focusing on results as much as possible. Definitely, there was a lot of skeptical people along the way, and I'm actually quite skeptical myself. But I'd have, and lots of love to all the men out there, but it would typically be the men more so.
It's true.
They'd have the arms crossed and just sit down, and I'd say, okay, so how can I be of service? What's going on? And they're like, well, why don't you tell me? And I'm like, okay, it's your visit and your money, and sure, let's dive in. And sometimes I could pick out some things just with some of the skills I had learned, and you'd see them kind of look at me like, how do you know that? And maybe it's a look in the eyes, or different Chinese medicine modalities of like feeling the pulse, looking at the tongue. Like, there's a lot that can be taken in without any words spoken. And once I started developing a greater wisdom and more knowledge just from treating way more patients, you could start to pick up patterns more quickly. And maybe I'd ask a very specific question, and that would kind of crack them open a little bit. And I'd say, hey, do you have maybe this symptom? Is that actually something going on for you? And they'll say, yeah, that's been going on for 10 years. Like, how do you know that? And there's a variety of pathways, I think, that I started learning around how to arrive at asking the right questions. And most of it is just being open and receptive and listening to somebody. And then they'd often open up and start sharing. And some of them would become my greatest referral source. And, farmers that would all be, sitting around the coffee shop in rural Alberta or prairie provinces. And suddenly I was seeing pretty much the whole small town in some of these places because I helped out Bob or something like that. And pretty soon somebody else is in there. Well, I know you helped out my neighbor there, and we thought he was going to die. Yeah. And he looks great now. So whatever you did for him, can you do that for me as well? And, just everybody from all walks of life, which I'm so grateful for, of like kids working with babies and teenagers and all the way up to people in their 90s, and learning something from every single person that I got to work with. And it's just so enriching.
Beautiful. So at what point did you start to go, okay, I've got this very busy one-on-one thing going, but at what point did you start to think that there was something you wanted to take to groups or take to larger groups? I
think for me, nature is such a huge part of my life. If I'm not in nature regularly, my psyche and my emotions maybe start getting a little bit jumbled. So I need to be around mountains or lakes and be in the forest with trees and everything. And through that process, I thought, what if I take patients into nature more through doing a retreat or something? And the other idea that I was starting to feel into was, okay, if we can create big transformation in an hour or a couple hour visit and, over time, what would happen? Because there's definitely some cases I wanted more time with them. I knew there was more to the story. I knew there was greater elements that weren't really being spoken to, or that we weren't tapping into, either because of time constraints, or they would come in and then they're going right back to the office. And so when that happens, and I know this for me too, if I'm going into a session where I'm receiving, if I've got appointments after, or I need to go back to work, you have your psyche and you maybe don't open up in the same way. So I thought, well, if we take people out of their regular daily life and give them a day or two, or even 3 or 4 days, I wonder what would happen. Like, what depth could we get to? And so when I started doing events like that, I got to see massive transformation in a really short period of time. And I found there was some magic that would start happening kind of around the 36-hour mark of them being away from their house or their spouse or their kids or their work or whatever it was, that they could actually just focus on them and focus on their health and really give themselves time to ask the right questions of themselves, or have me kind of, guide or facilitate in different ways where they could reflect and start finding the answers for themselves. And they would have huge insights. And often in nature, nature is so powerful when we're connecting in, that sometimes the answers spontaneously arise where you're looking at a sunset, or you're sitting with your back up against a tree because you're not answering emails and you're not on the apps and everything else. You're just with yourself. And I think our bodies are often wanting that, but maybe haven't been given that opportunity or haven't been given the time and space. So that got me really excited because of what I was seeing. And people would look different. And we started taking pictures sometimes of like, do you realize you look 5 or 10 years younger after 3 days? And they would notice too, and their friends, and they'd be sending me messages. Yeah, everybody's asking me what I did, or if I've got work done or something, I just look happier and my eyes are bright. But we would just be removing obstacles and blockages and, bringing attention or shining a light on things that normally we wouldn't necessarily get to fully in an hour visit. And so I thought the combination of nature, I feel better in nature too, so I'd be at my best. And then it would give people a chance to unwind things that needed more time and needed more presence and depth. And that was like a whole new opening for me.
And that was how many years ago that you started doing that?
2019, so it was 6 years ago.
Were the events called the New Human Experience then, or is that what it has evolved into?
That's more of the more recent evolution.
Yeah.
So back then, a good friend of mine, Emily, we did a retreat in Banff, Alberta, if you've ever been to Banff, but
I haven't.
Massive mountains, like big rocky mountains, and just the most pristine lakes and glaciers and things. And so we brought a group together there, and I got to see some tremendous transformation. I experienced huge change as well. And I think we called that one Awaken the Superhuman, something like that. And it felt like it did that for those of us that were there. And then I collaborated with a dear friend of mine, Courtney, and we founded a series called Collective Hearts. And it was never a plan. We just, had some good synergy. She's a somatic therapist and so much more. And we thought we had some synergistic gifting that we could bring together and facilitate together. And we ended up doing 9 of those over a 4-year period.
Wow.
And like kind of smaller groups, more intimate, 10, 15, like 20 people. And usually, 2.5, 3 days roughly. And we'd get into some really deep territory and see just amazing things happen. And so doing a lot of those events, and I had an event in Tofino out on Vancouver Island several times, and it was called Cosmic Surfing in Tofino, and we'd be surfing the waves of the vastness of who we are, but we'd be doing deep treatment as well and work with groups. And so through a lot of those experiences, I got to learn a lot, and I got to see what worked, maybe what didn't work, and how that evolution would continue, and started getting ideas and visions through meditation, or sometimes maybe just staring out the window, of what if I did a bigger event, for one day that would be easy, accessible for people. They could kind of, tiptoe into something new a little bit and without a big commitment, and, they could come and go if they wanted, no pressure. And so we started doing those maybe 4 years ago, I guess. And I ran a few events like that, just one-day events, and that just kept growing and evolving. And, these visions that drop in occasionally, I started envisioning something bigger. 2 days, maybe we could go a little bit deeper, and it needed a name. And as I was sitting with it, the New Human dropped in as, I guess, a vehicle or a concept that I don't think I came up with myself, but I was listening. And so that was born, and now we're on that path, and it keeps growing and feels like there's a lot of momentum. And you and I were chatting earlier too, of like the in-person events are really special. And there's something intangible and tangible that doesn't always get to be named, but a lot of things happen when you're around other people that are sort of moving in a similar direction, and it lifts everybody in a beautiful way.
It's true, being in that collective energy field. And also we were both saying that one of the things we love is learning that people have made like friends, and they're still friends like 5-10 years later. And I have friends from 25 years ago when I first started going to self-growth workshops that, I'm still really close to. And I think there is something about the coming together under the umbrella and the focus of transformation for people who are that way inclined. It just elevates everything. So there's the transformation, but there's also all these collaborative connections, and it's like pieces of yourself come back to you in a really profound way. So with this event that you have coming this year, you've called it Interstellar, which is a movie I've loved and seen a few times. I know that it wasn't the movie you named it after, but tell us a little bit about what Interstellar will be.
Interstellar, I think, is the next layer, the next version of the New Human events, because each time they're different. And, I tune in and spend a lot of time in nature and in meditation, and just giving myself, time and space to think of what wants to be brought forward. What is it that is wanting to move through me in a really deep way that is, maybe beyond what my mind has to say, even as well, of where we're at right now in humanity. So many things are changing, and it's a really creative time as well if we can kind of guide and steward that energy. So that's kind of what it feels like for me. The next layer is going deeper, both into the cosmos, but also inside, and that beautiful marriage of like earth and sky, and heaven and earth, and all the different types of words that can we bring that together in a really, really deep and impactful way that, honors the the stardust that's within all of us, and the earth and the minerals and everything else, and we're earthly beings as well, and we're many things. And I've been fascinated in my personal life and as a practitioner to just learn more and discover more. And then as I do that, then I can bring more to those environments and maybe shine light on things that most people don't talk about or haven't gone deeply into, and understanding what it is to be human, and in our messiness and in our emotions and everything else, and having a space where all of that could be held, but that we can actually ground that into a new level of embodiment. And definitely something with the events that we do, it's not just a mental concept, that I don't just want teaching or ideas coming forward. So we'll often share some things and then we go into different processes, because I want it landed in the nervous system. I want it embodied so that when people leave there, they are different and they are changed, but it shows up in an authentic way that their relationships start to change and their health has changes. It's not just, that was a fun weekend, great, met some good, people, had some fun, but the change happens at a deeper level, maybe even beyond what their mind understands, but maybe a few months later they've met somebody new, started a new job, new career, things change. And so that's the beautiful part I love about community and working together in this way, that I'll get messages weeks and months later, a year later, saying, hey, that impacted me in so many different ways that I didn't even understand until now. But I can trace all the steps back of what happened that weekend and what changed that weekend. And they'll share like a big letter, a big email, and think, this is why. If we can help one person and many more, then you can change community and you can start to bring more consciousness, but it's embodied. Because I think some people forget about the body. Mm-hmm. We can have a lot of big ideas in this awakening and everything, but we'll still, we're here and we need to look after our bodies. We need to tend this garden in a big way. So we do a lot of that at these events.
Beautiful. And it's funny, I noticed that myself coming into the spiritual field initially as a teacher and a channeler after being a student for many, many years. I really got to see the certain group of people who go to spirituality or intuition or psychic ability as a way of, in a way, remedying the problems that they've experienced on the human level. So it can almost be like you ping out the body for a while, mm-hmm. and you go to those dimensions and you nourish yourself there and you learn things there. But there comes a certain point on that journey, if you're paying attention, where we're asked to come back to the body and now reconfigure everything. Mm-hmm. And I've noticed that can be an edge for people, especially if they don't have the right support in place that they might need, particularly if the trauma is quite high for them. It's mm-hmm. not as simple as having some fears. It's, there are some serious areas of trauma or blockage here that the mind alone can't just push you through, and that revelation can't turn into transformation. I always talk about the difference between an epiphany or a revelation. It's like, okay, that's part one, but how do we actually embody it? That's usually the harder task or the more time-consuming task. And so it's great, you're not the only person I hear speaking about this now, but it's good that we address that part of it too, because it's so important. This vehicle mm-hmm. is what we can then emanate and become. So, yeah.
Well, and I've met a lot of gifted practitioners and healers from all walks of life, and people that channel or mediums and things. And I tend to see a lot of, really gifted people in my clinic and at retreats and things. And some of them have a lot of significant aspects going on with the body. And in some ways, it's almost like they've spent too long without really being plugged into the physical vessel. And that's kind of been forgotten about. And it doesn't mean we're taking anything away from the gifting, but it's almost like the gifting needs more of a home in their system to actually flourish more. And it seems like as they come back into their bodies in a really healthy way, in a really balanced way, and maybe we need to do some clearing and detoxing, because everybody's human, me included, that they start to actually have increases in intuition and increases in the gifting that they had before, where maybe they were, thinking, well, if I get too dense in my system, I'm going to lose that gifting. But in my experience, it's actually amplified it, but they're healthier. And they're more grounded and rooted, and their body is thanking them for it, and they have more energy, and their sleep gets better, and all of these different parameters that the body needs to thrive. Then it comes back online in a new way, and it seems to open up next levels for people.
And I have met many of the people you just diagnosed, and some of them have been friends. And yeah, that's been an area I've noticed a lot, particularly in the intuitive or psychic realms. This idea that you don't need your body to do that, but actually I would argue the opposite is true. I know for me, when I'm channeling, it's so physical, like it's so much energy that runs through the nervous system. So that has been its own education process for me around how do I take care of myself, and that's ever evolving, particularly as we continue to get into a more intensified world. I think all of us have to constantly tweak things.
Well, and paying attention to the body is something I coach everybody on, both in groups and in the clinic, that our body's speaking to us all the time. But most people, and in North American culture perhaps too, without trying to blanket statement it, haven't really been taught or brought up in a lineage where that was regular practice. And so sometimes I have patients that come in that say, hey, I've been great for 30 years and now all these major things are happening, like I don't know what's happened. And I usually think, you can't tell me nothing was communicated through your body over 30 years, like were you actually listening? And they often were not, once we start to unpack what that means. And like, oh yeah, I have felt this thing, but it didn't seem like a big deal. And no fault to them, it was just the way they were thinking about life at the time, or their body, or what they were taught, and focused on work or focused on achieving, and sort of just continuing to push past the little whispers of the body. And then eventually it becomes like, you can't ignore it anymore. The body starts speaking loudly enough. So one thing I've discovered, and this is just my view, whether it resonates or not, is the body can't lie. The body is like a very, very sophisticated communication network. And it's like infinitely more intelligence than what I can even understand. So I've learned more as a practitioner to listen to people's bodies even more than what they say, because the symptoms, the issues that they have, the places of tension or inflammation give me so much information. And I'll still very much listen to what they share because I want to know their story. But I'm often more attuned to the body and what's happening, because that kind of tells me the truth. The mind can say a lot of different things. I'm eating healthy. No, I'm living my life really well. And maybe I get in there and ask a few questions and I start to determine there's actually big gaps in between what they're saying and what their body is actually communicating. The body's telling me the real story.
Yeah. Or what they perceive is healthy, because everyone's version of healthy is different, right? Based on programming and cultural or parental influences. And yeah.
Absolutely.
You mentioned listening to the body, and this is something that I know is a thread for you. We've talked about it just before starting this conversation, the power of listening to people. So I'm curious, two things. Number one, well, let's start here and then I'll ask you the other side of the question. When someone hasn't felt listened to or been listened to, particularly around their health challenges, what kind of impact do you notice it has on them when you sit there and you listen to them and they have the experience of being listened to?
Quite often tears show up right away, because in some cases, unfortunately, they've maybe been in so many offices where they tried to share, but they weren't given space to, or they weren't really respected, or they weren't listened to in a way that actually landed deeper where they felt heard. And quite often I find, and I've said this to many patients, that people often know what created some of their issues and created some of their illnesses, but they've been convinced that it wasn't those things. And if they've been to enough practitioners, oh no, it wasn't that. So I'll often ask people, if we just drop everything else right now, drop the labels, drop whatever the diagnosis is, just like, let's just sit here together. What do you think were like major events or different things that sparked the illness that you're now experiencing? And they might take a minute, and in some cases say, I don't know. But if given enough time and space and just me authentically sitting there wanting to know, they'll say, this thing happened when I was 10 or 20 years old or something, but I brought it up to other doctors and they said, oh no, they wouldn't have anything to do with that. And that's usually when I get curious, is tell me more about that. And they start sharing more of the story or the impact or whatever it was that they felt. And maybe they stepped on a thorn and they got an infection and they end up in the hospital and got a whole bunch of treatments. And I'll say, like, did you ever feel the same after that though? And they'll say, no. I never felt the same after that, but I haven't been able to put my finger on it. It's like, well, whatever happened, the treatment, the infection, like whatever that was, that still may be active in your system, and that may still actually be impacting you. And they might just take a big breath and like, oh, I've always thought that it was related to that, but, and then, yeah, maybe the tears come because we've touched on something that they knew inside. And I think that's usually what happens, is they feel a sense of relief because they don't have to convince me. They don't have to argue with me in any way about what they think is going on. I'm like, why don't we just trust what your body has to say? Because so many people have almost been trained out of trusting their body. But as we, come into connection and come into that closer proximity of asking the right questions, or even just giving them a chance to share their story, they may have different insights, or I might reflect things back to them a little bit, like, hey, this sounds like, or it felt like there was some energy. Can you tell me a bit more about that? And suddenly we're down a different pathway that leads to a big emotional release. And then the hope starts returning of, oh, maybe are you saying I can get better? And I think, yeah, that's not my choice. Like, what's your choice in this? We're like, well, yeah, I want to go into that. Like, what else is going on here? And that's when they start to get curious, and you see I've literally seen color return to somebody's face just through a conversation of me listening, reflecting, answering questions, and they get up out of the chair and they've already experienced a shift, and they might look at me and say, what did you do? My back pain is way less than when I sat down, like, but you didn't do anything. And I think, yeah, listening is maybe not always something you're doing, but we're just in presence, and just that space to have somebody get things off their chest and feel heard has been like an eye-opening element for me. I didn't know that at the start of my career, that I could just listen to somebody and hold that space and really be present with them, and that would actually potentially shift a lot of what's going on in their body.
Was it the practice of doing your work that developed that skill for you, or was there some kind of personal epiphany or active learning around listening?
I think a little bit of both. The practice I was running would often inspire me, especially cases where I didn't know. I didn't know how to help them. I didn't know what was going on, and I needed to go deeper. So sometimes I would just, go for a walk and hold that person in my awareness and ask, what else am I missing here? Like, show me something more here. I want to be of service to this person, but I'm not quite getting it. And sometimes then I would get shown something, or I would have a question that came up that I hadn't asked them yet, and say, hey, hang on. I'd send them an email maybe, or the next visit. You remember telling me that story about this and this, but like, what about this view of it? Or did this happen as well? And they say, oh yeah, it did. And it would suddenly open a door that seemed like it had been closed for a little while. And so that also started telling me, what do I have going on in here? What doors need to be open? And so I've done a lot of self-exploration and just, digging that garden of, maybe there's some weeds that need to be tended to in here, or places that I didn't have enough support or enough nourishment for myself, because I did have a tendency, and still do at times, to focus on what's happening for everybody around me and forget about me and checking in over the time. So a lot of practitioners I've met have been through this, where they get into burnout. They work super hard. I've met a lot of doctors too that are working in hospital settings, and nurses and things, that they're working an insane amount of hours, and they come in for support to see me, and they're just so burnt out. And I think, how is this going to be sustainable? We need to create some changes here, and they need more nourishment. And I started to see that in myself. And there's definitely been times in my career I got burnt out and started to question, like, how did I get here? How am I showing up in my day-to-day? And where am I really overextending and not honoring what my body needs? And if I'm not doing that, I'm not walking the talk at all. And I'm not going to be of service at a higher level. Like, I'll be limited in what I can offer to people. So yeah, a bit of both. A lot of practice, learning with each patient, and then a lot of self-exploration of what else is here for me to excavate or work with, that then I can actually show up even better in the clinic.
Beautiful. And that is the gift of burnout, isn't it? Because I think, the gift of burnout, I mean, as you've said, it's happening in many professions and many people's lives, I think. But certainly the path of healers and practitioners, and I've gone through my own rounds with it a few times, and I speak to lots of people and have worked with lots of people who've hit that wall. And the gift of it is we need to take a we need to take a different look at the way that we're playing the game, and let's try and do a good 360 and give it some time, and layer by layer you get to unpick all that stuff. Well, Kevin, thank you so much. This has been fantastic, and what I really enjoy about you and your work is, number one, it's so needed. Number two, your dedication. And number three, you've got such integrity and passion around it. So I was excited to have you here today to learn more about what you do. And I know that many things that you've said will be pinging for people. And I also, want to share with everyone watching that you are continually developing programs for people, including a year-long program and various ways that they can work with you or interact with you, as well as, of course, the New Human Experience, which this year is in October, Interstellar, if you happen to be catching this in 2025. So thank you for being here, thank you for doing what you do, and thank you for impacting the world the way that you do.
Well, thank you. It's an honor to be in presence with you. It's been a lot of fun. Really appreciate everybody listening, and thanks for holding this space.
Thank you, Kevin. So you can find everything from all of Kevin's work at the links below this video, and thank you for tuning in today for Impact the World, and we will see you next time.
Embody your unique gifts as a healer.
I think for all of us, this is a next level time on Earth, and therefore that means it's time for the healers of the world to go to the next level in their own ways of being and their ways of serving.
Next Level Healer with Lee Harris. Whether you are a seasoned practitioner or just beginning, join us for channeled guidance, powerful teaching, community engagement, and supportive worksheets, and allow your gifts to bring change, healing, and elevation to the lives of others. This transformative 2-weekend live broadcast is designed to help you cultivate a strong sense of grounded presence while being deeply supported to receive healing energy.
Lee brings out my very best ideas and shows me the way to continue on my path more consciously, and helps me clear away fears, blocks, and the fog that self-doubt can bring, and transforms it into strength and positive energy.
Deepen your creative, intuitive, and visioning abilities, overcome fears of judgment, and expand your outlook from scarcity to abundance to enhance your healing work and guide others with greater clarity and confidence.
We're at a time in the world where more people than ever before are beginning to come up against emotions, experiences, and a world that is asking them to look within, know how to look after themselves, and it's often healers or therapists or facilitators who help us uncover that.
From the comfort of your home, connect with us for 2 weekends, starting May 17th and 18th. There has never been a time when healers are more needed. Take your healing to the next level. Next Level Healer with Lee Harris.